Hi everyone. This week's case study is actually a comparison, a follow-up to one of the case studies we shot. I don't know, it's probably at least a month or two ago. And this particular client, as you can see with the picture, had a severe, probably one of the worst deviations in his pelvis that I've ever seen. He had a total hip replacement on his right side. And you'll see with the first picture, he's really, really high, probably like almost 2 inches off. The podiatrist had put a lift in his shoe, and then what he's really complaining of right now was he had a lot of right low back pain. So you're going to see in this picture that with the second one, it's still elevated, but I mean, he also has a hip replacement, so we're not sure if that was actually a true fit or not. But it's still significantly lower. And what I want you to really pay attention to is where his torso is in relationship to the plumb line. You'll see the before pictures, torso is completely shifted over, and you'll see the after where he's more centered with the plumb line. And that plumb line is directly in between his feet. So that's important to note. That's how much of a difference there is. So as that pelvis dropped down, the torso started coming over. So I thought this would be a great follow-up, partly because of the level 3 that we did, talking about the torso deviation, but how that blends in beautifully with the pelvic deviations, which is the elevated pelvis. So the most recent routine, basically what we've been going after, I've been really focused, I've seen him 6 times, I've been really focused on going after the pelvis, of course, because I knew if we could get that, he was going to start shifting over, and we have. The problem or the concern still is that, you know, I want to get it better, and again, I'm not positive we're going to be able to get it completely perfect because I'm not sure what size prosthesis they put in the hip there. So in regards to his symptoms currently, he's feeling better with his gait. He's definitely walking much better. He doesn't have that limp because of that big leg length disparity. Low back says more of a soreness and a stiffness versus pain now, but he's still getting his right leg still weaker. But overall, I just wanted to really point that out to you, and what I was going after is, at this point right now, I'm still going after the pelvis like I just said, but I'm actually doing more torso stuff with him. So I'm actually combining some of the torso deviation stuff with the pelvis. So, you know, if you have questions, please don't hesitate. The member site's there for a reason, to ask questions and to help educate you guys. So we are going to have an announcement of level 4, and then also we're going to have an announcement of the level 1 that's upcoming. So we got a big list of people for that. So we'll see you probably next week, or if not 2 weeks, but I'll try to do it next week. So all is good. Take care.